Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. We have invited back again Dr. Carlos Munoz, our family medicine doctor, and we are going to continue our conversations on diabetes.
Hi, Donna. Thanks for having me back.
It is good to have you, and I'm excited to continue our conversation on diabetes. We are learning so much. So, Dr. Munoz, how does the disease process of diabetes start?
Diabetes is type 2 diabetes in particular is the most common type of diabetes. Type 1 is rare. That's 5% of usually youth get type 1 diabetes. Type 2 diabetes is usually, this is an inherited disease that requires a couple of things for it to bake and grow, so to speak. I mean, it requires that, for example, typical patient will have several family members who have type 2 diabetes, and nowadays life is mostly sedentary as opposed to previous generations where people walked to work or walked for work or worked out in the fields, and so nowadays we're more sedentary, so that adds to the higher risk of becoming diabetic. Also the food that we have nowadays, we've got food everywhere. We've got fast food, we've got, you name it, burgers, fries, we've got shakes, we've got Cokes everywhere. The foods really help to bring this on, along with the family history and also the lack of exercise.
Okay, so would somebody have symptoms right away if they have diabetes?
That's a question that I get quite a bit. And it's funny, but you can be a diabetic. You could be a pre-diabetic, or you could have somebody who is full-blown type 2 diabetes, and let's say their glucose is over 300. I've had a lot of patients tell me that, wow, doc, I didn't even know. I didn't have any symptoms. So to answer your question, you don't have to have symptoms to be a diabetic. Now, there are some people who will come to the office and they come in for a checkup and yes, doc, you know what, I've been so tired. I've been thirsty, going to the bathroom frequently. I've been losing weight. And, sure enough, we do a check in the office. We just do a finger stick and their glucose is really high. So, yes, some people do get symptoms, but there's a lot of people, I would say probably most people don't really know that their sugar's high. A lot of times it's just kind of a surprise. Hey, by the way, your sugar's really high. Did you know this? No, I don't really feel anything.
So this is kind of a good reason to have a physical.
Oh, yes, definitely. Once a year, you just want to get your blood checked, and especially if diabetes runs in your family. Or let's say if you have somebody who's maybe doesn't have a family history of diabetes, but they know that they're overweight and they're not getting proper exercise, not eating healthy. Yeah, I would just say just get a once-a-year physical and just make sure that there aren't any signs of pre-diabetes or diabetes.
Well, Dr. Munoz, you hear more and more that people are getting, our young people are getting high cholesterol and diabetes and everything at a much earlier age because of the diet and the non-exercise and that kind of thing. So what would you recommend for people to start getting tested at or checking on it? If there's grandma, grandpa, mom have diabetes, when should the children get involved?
That's a good question, because you really should start screening probably earlier if there is a family history of diabetes, or let's say if you have a child who's overweight. Let's say if you have a 5, 6, 7-year-old who's overweight and there might be a family history of diabetes. Yeah, it may not be a bad idea to have them get some blood work. And for the little one, what I'll check is not only just the usual fasting glucose and the hemoglobin A1C, but for the younger ones, I'll check their insulin level. And when you have somebody that has insulin resistance syndrome, or let's say they've kind of moved from that into prediabetes, their insulin levels will be really high. And so over the years, I've had to, for example, school nurses will tell the parent to send the kids to go get a checkup because they have this dark skin around their neck. Well, that's a sign of a lot of insulin in their body or insulin resistance. And so I'll do the blood work, draw an insulin level along with the regular stuff, the glucose and the A1C. And the glucose and A1C are typically normal, but the insulin level is high. And so that's when you really want to intervene in a child's life. You want to go over the diet with the parents and have them stop, going to McDonald's. You want to stop eating the pizza and fries and Cokes, and you don't want to give them the Capri Suns and the juices and things like that. You want to get them away from all the sugars and then get them more active. It's so easy nowadays to give the kids a laptop or a little iPad and they just play and entertain themselves. When I was growing up, we were playing out in the street, and that's what kids need. They need exercise. They need to run and metabolize all the food that they're eating instead of just sitting on the couch playing games, things like that. But yeah, you can intervene at an early age just by doing some blood work and just by maybe perhaps if there is an overweight child, just look at their skin and see if there's any dark areas. So when you see that, that's when you want to go take them to the doctor and just get some blood work.
How does the disease process of diabetes affect the other body symptoms? Because I would think early detection could help in this or slow the process.
Definitely. So once somebody is a diabetic, you've got to check certain organs regularly. The organs that can become damaged by the high sugar. For example, in diabetics, you've got to have them go see the eye doctor once a year because the sugar affects the arteries on the back of the eye and the retina, and it can actually damage those arteries. You can have growth of these little arteries, and they can pop. And when that happens, you lose vision, and it requires a big surgery, big intervention to fix that. So you can actually screen for that and catch it before it causes damage. And you can do that for example, the heart. Just go get a stress test, get an EKG, just make sure everything looks normal. Cardiologist can do a 2D echocardiogram. A lot of times with diabetes, people are overweight, so you want to check for sleep apnea because sleep apnea can start to affect blood pressure and cause a lot of fatigue. Some of the other organs you want to screen for, the big ones, for example, the kidneys. And it's just a simple urine test that you can use to see if there's any evidence of diabetic kidney damage. And of course, with the blood work, you can see if the kidneys are working fine. Because over time, if the sugar is high, if the hemoglobin A1C is over 7, that can lead to damage of the tiny little arteries in the kidneys, and you can start to see evidence of that in the urine and also the blood as it gets further along. Of course, another organ that can become affected is, for example, the nervous system. The nerve endings, when the sugar is high, start to get damaged. The sugar is directly toxic to the nerve endings, and so a lot of diabetics, when let's say if their sugar is uncontrolled, will complain that, yeah, doc, I feel this tingling, pins and needles, burning perhaps, or cold or hot sensation in the toes, bottom of the feet. That's a sign that the sugar is damaging the nerves. Now, a lot of times, if it's early, you can get them on a diet, maybe change their medicines and get their sugar down, and that can go away. But if you leave it, if you don't really do anything about the glucose, that damage can become permanent. And so the tingling and the pains can progress to eventually just complete numbness. There's no sensation in the feet. And so, of course, that's dangerous because if they get a little cut, they wouldn't know. But yeah, there's a lot of tests or just screenings that you can do just to make sure that the diabetes isn't hurting the end organs, as they call it, the target organs of the sugar.
So, with diabetes being a genetic thing, if you're not getting symptoms, which most people don't, you could get in trouble if you're not regularly seeing your doctor and just following up on your annual physicals. So is that why we're seeing a lot more amputations and renal insufficiencies and dialysis patients having to go on dialysis?
Yeah, dialysis, the number one reason is diabetes. Number two is high blood pressure. So yes, I mean, that's something that if it's addressed early enough, you can prevent a lot of kidney damage years before they ever have to go on dialysis. So just by simple screening, yeah, you can really help somebody's life, help extend their years if they're compliant and they're motivated to get the glucose down. Definitely.
And I guess we ought to stress it in our younger audience more because I remember being young once. I'm young, I'm too young to get this, or I'm too young to get that. It's happening to young people now. So probably ought to get checked and do your annual physicals.
It really is important to do your physicals because I've had patients in their 30s who have had open heart surgery, bypasses. I mean, it's crazy to think of, but that really can happen. Cancers happen in their 30s as well. You just would never think when you're 30 that you'd ever get cancer or have, heart surgery, but it does happen. So yes, it's important just to go see your doctor and just, if you are diabetic, just make sure you go every 90 days. Let's say if you're pre-diabetic, maybe go every 6 months. If you're insulin resistant, let's say if it's in your family and you're concerned about diabetes, at least once a year.
And that's not only just for diabetes, it's just a good practice to have your baseline with your doctor and get to know them before there are any problems.
That's exactly right. Yep.
So we talk about diabetic diets, and I don't think there's any specific diabetic diet, but we have the keto diet, Mediterranean diet, we have Palo, Atkins, all these diets out there that are supposed to be good. Are there some diets can be harmful to the diabetic patient?
That's a really good question because you've got to look at each diabetic individually. Let's say if you have a 35-year-old who comes in and they're diabetic, let's say new diagnosis, and their kidneys are normal, really no other problems other than you just want to get them to get on a diet and take their medicines, get the sugar down. So somebody like that, I would say maybe getting on a low carb diet, barely diabetic. Let's say they have diabetes, but their sugar's really not that high. Maybe getting on a low carb diet, a keto diet, and dropping some weight, that might be helpful. Now, that diet to, let's say, an 80-year-old diabetic whose kidneys are not what they used to be at 40, and they've got maybe some heart problems, maybe they've had a stroke in the past, and they're taking several medicines for high blood pressure and et cetera, and other conditions. A keto diet, high protein, low carb diet would probably hurt their kidneys. The extra protein, if you have what's called chronic kidney disease or renal insufficiency, where the kidneys are still working, but they don't work quite as they used to, chronic kidney disease, you can actually hurt the kidneys by having them go to straight low carb, high protein diet. That extra protein can damage the kidneys. You've got to take each diabetic patient individually and just see how they're doing first, and then you can recommend what kind of diet. For example, somebody, let's say maybe with early mild kidney disease, who's got high blood pressure, taking several medications to control, maybe for them, perhaps maybe seeing a dietitian to get a calorie count diet, a more traditional style of dieting, something that we use in the hospital, as opposed to, let's say, a keto diet. But then let's, compare that to a 40-year-old who's, healthy other than maybe just their diabetes and maybe a little bit of blood pressure, but everything else is fine. Yeah, maybe for them a keto diet might just really help them lose weight and get the sugar really down or cure it if possible.
So I think what I'm hearing is if you go to your doctor and he says you have diabetes, follow a diet, get your blood sugar down, get in drugs, talk to him, ask him if he doesn't volunteer what kind of diet would be good for me. Because it sounds like all the diets are okay. It just depends on where you are physically.
Right. It just depends on, the status of your kidneys, status of your liver. Yeah, liver disease requires a specific diet. Kidney disease requires a specific diet. So, you have to find out about where you stand with your organs, and then, ask your doctor specifically, hey, what kind of diet do I need to follow? Can I go on a keto diet? Or do you think I should see a dietitian, maybe to talk about what to eat, what's not to eat? And that's what a lot of physicians will do, refer you to a dietitian if you need some specific help with what do you like to eat, what kind of foods do you prefer, what kind of things can you eat, are you allowed to eat, that kind of thing.
All the things you said we couldn't have.
Right.
But a dietitian becomes very handy. I hear a lot about diabetic ketoacidosis. You want to help me with this?
The ketoacidosis?
Thank you.
Right.
What is that exactly?
That is a condition that will put you in the hospital. That's a condition that will put you in the ICU. Diabetic ketoacidosis is it's a condition which will primarily occur when a diabetic requires insulin to treat their glucose. For example, textbook case would be a type 1 diabetic. Type 1 diabetics are younger people, maybe perhaps a teenager, even younger sometimes, and they have to take insulin to keep their glucose down. And so, for example, a textbook case would be, let's say, that youth, that teenager, just decides, you know what, I'm just tired. I don't want to take shots. I don't want to take my insulin. Well, what happens is their sugar starts to climb pretty fast. And so they start to urinate. They start to get dehydrated. And so when you get dehydrated, your muscles will start producing lactic acid that builds up in the blood. You get that word acidosis is when you have too much acid in the blood. Your blood becomes too acidic. That could be deadly. And so that can also happen in a type 2 diabetic. Let's say somebody who's on insulin, who doesn't really produce that much insulin from their pancreas. They rely on shots of insulin to control their glucose. If they don't take care of themselves, their sugar could start to climb, and they get dehydrated because they're urinating so much, and they're not drinking enough water, and pretty soon you start building up lactic acid in your blood, and you get confused, you get weak, maybe nauseous, and lethargic, maybe comatose. And typically the patient's taken in the emergency room, and a typical case, you might see somebody's glucose of 800, 900. I have seen diabetic ketoacidosis where the glucose was only like 250. You measure it. There are different tests to measure to see what you have, to see if you have this condition. Typically, they do an arterial blood gas. That's a blood test drawn from an artery, typically in your wrist, and it tells you the pH of the blood. So the pH is measuring how much acidity there is in your blood, and the normal level is 7.4. And so, maybe somebody with DKA, diabetic ketoacidosis, they may have a pH level of, for example, 7.1, 7.0, 6.9. And so these patients you have to put them in the ICU because you have to draw blood every 1 to 2 hours. You've got to check their potassium because it typically goes low. They're so dehydrated. You have to replace other electrolytes. It's typically treated with insulin on a continuous drip. It's called an insulin drip, but what you're treating is acidosis. You're treating the acid in the blood with IV fluids and with the insulin. And eventually, usually within 36, 48 hours, you can pull somebody out of this. But it's labor intensive. You got to do blood every 2 hours just to make sure that their potassium doesn't go low, which of course you need potassium for your heart. So if your potassium's too low, that can trigger an arrhythmia. Yeah, diabetic ketoacidosis, you don't see it too much, but it's out there. Oh, yeah, definitely.
So how would a patient know that they're getting in trouble? Is there a warning sign where maybe you can catch it earlier and know you need to go see the doctor?
So if you start let's say if somebody's feeling sick and for whatever reason, they could have the flu or some sort of infection on their skin or something, and they start getting nauseous, weak, they don't eat or drink very much, that's a warning sign. Start checking the sugars. And so they might start going up, maybe 250, 350, 450, and it starts going up. And if they're starting to get dehydrated, let's say they don't urinate very much, but then when they do urinate, it's really dark, showing that they're dehydrated, yeah, you'd really be concerned at that point about DKA. That typically they're going to be weak, headaches, nausea, just lethargy, really not wanting to do much. Yeah, if you check their sugar and it's high, then yeah, you want to take them to the emergency room.
That's good information to know because I would think the faster you get to the emergency room, the better your survival rate.
Oh, most definitely, yes. If you get to the emergency room and let's say pH is maybe 7.2, that's a big difference between, let's say, somebody whose pH is maybe 6.9 or 7.0. That's a big difference. I mean, if they're 7.28 or something slightly acidotic, oh yeah, they'll pull out a lot quicker than somebody who's much more acidotic, as they say.
So listen to your system, and in doubt, always go check it out. So, in reference to exercise, is there anything patients with diabetes need to know prior to starting, like a fitness plan, certain shoes or inserts? If they have neuropathy, is there anything they should be worried about when they go out and start moving?
Number one, you want to definitely wear some sort of soft, comfortable fitting sport shoes, something that covers your toes. You don't want to go out and go walking in flip-flops or anything like that. You really don't want to expose your toes to potential cuts. So, yeah, just wear something comfortable. Athletic shoes nowadays, really comfy, squishy, lots of air in the soles. Yeah, something like that would be perfect to go out and walk in. But yeah, just stay away from the flip-flops, less chunkless, that kind of thing.
Okay. And socks. Should you always wear the socks?
You know what? That's a good idea. Just for everyday wear, diabetic socks are really just soft and comfy. They're typically made. You can order some bamboo socks. That sounds really. Every time I think of bamboo, I think of the bamboo stick, something really hard. But they make. If you look it up, bamboo diabetic socks, they're really soft and comfy. Something to even for non-diabetics.
Yeah, I love
Wear.
bamboo socks. They are great. And you can get them just about anywhere. What are your take on diabetics wearing support stockings?
Support stockings, typically I would recommend those for somebody, let's say, who has maybe varicose veins, or somebody who has some swelling in the feet or legs, and you're trying to compress the veins a little bit. If you don't have that problem, then probably don't need to wear them. I would just stick with regular diabetic socks. But compression hose, if somebody has trouble with their legs, let's say, they travel San Antonio, the legs start to swell a little bit in the car, take a plane ride, or just walking, for exercise, you get some swelling in the legs. That's when I would recommend the compression stockings. But if you don't have trouble with swelling, then I wouldn't, worry about that. So I wouldn't wear compression hose. I'd probably just use just regular socks.
Okay. Dr. Munoz, this has been some valuable information. Is there anything you'd like to add to our session today that we haven't covered?
Well, I guess, just make sure that you see the doctor just to get a checkup. Schedule a physical, and if you are diabetic, just make sure you've had at least 1 EKG in the past, and make sure you go get your eyes checked. Make sure that you show the doctor whatever supplement meds you may be taking, especially if you're seeing specialists. Yeah, show your primary care doc what medications you're taking.
Dr. Munoz, it sounds like we haven't had those physicals. Let's get them. Early disease protection is the best. If you don't have a primary care physician, I'm sure Dr. Munoz, you're still taking patients and seeing patients along with doing diabetes. You do all realms of family practice.
Yes, I do.
So get in with the doctor, talk to your doctors. They want to hear the truth so that they can help you and prolong a great quality of life. Dr. Munoz, thank you for joining us today. And a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Dr. Munoz will be back with us next month. If you have any questions, please go to our website and ask some questions, because he'll be here to answer them in another month. Thank you again, Dr. Munoz.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.